I'm very excited now to introduce our next speaker, Dr. Sharon Bober, who is a leader in sexual health here at Dana-Farber. And Sharon here. Oh, there she is. Thank you. And so when we talk about breast cancer risk and these risk factors and things that we can do about it, one of the things that I mentioned was the medications. And as we all know, every medication, no matter what the good side of it is, it's also always has a bad side, always has some side effects. And so one of the challenges that we face in counseling women about these options for risk reduction is how do we balance the risks and benefits of these medications, or also how do we help women who are just dealing with side effects of menopause naturally as they go through life, and we're trying to help them with their breast health. And so Sharon is here to share some of her work around that, and thank you so much, Sharon.
Nice to be here. They always put sex right in the middle when you're about to fall asleep, so hope everyone's ready to roll. We'll just make a quick comment that, and I have to say thank you for having me here. I'm delighted to be here because, often for so much of the time, the sex is not on the agenda, in terms of just thinking about potential side effects or impacts of treatments or different kinds of options that we have. And that, we live in a funny culture because it's really saturated with sex, right? So that's everywhere. But that's very different than sort of real conversation about real sex with real people, right? So I appreciate the opportunity to talk with you a little bit about this. And just to say that sometimes we, in the context of being a patient or going for consultation or treatment, we notice that nobody asks about this, and that I just want to clarify that, from the provider point of view, it's interesting, we really don't get any training, in how to talk about this. So it's a funny thing in terms of the elephant in the room, because often people have questions, and often providers feel like it's an important topic, but themselves aren't quite sure what to say about it. So, what I would invite you all to do with me this morning is to sort of think about kind of an attitude, really about just being prepared. And that really is about getting educated, thinking about whatever questions you might have, potential side effects of treatment on sexual function, and just really sort of making this, kind of putting it on the list of things to think about. And that also, implies that you need to be aware of your own experience, right? So sort of just noting what's of value to you, what might be curious that you're sort of thinking about in terms of what's important for you and your partner, and really cultivating a sense of compassion for yourself, because these are hard things to think about. When you're weighing what this might mean, that you might be having a surgery, or you might be going into menopause, or you might be thinking about a medication that potentially has menopausal side effects. And we really need to be able to sort of know that there are things we can do about it. And that's really the point of my talk here today with all of you, is to recognize that, yes, there may be potential side effects, yes, there may be impact on sexual function, but the good news is that we really have a number of great strategies to bring to bear. We can improve sexual function if it's changed or different, and that even though you might not hear a lot about it, it doesn't mean that it's not treatable. And I think that's the major misconception often that women have going through this process. Is that, people often think, well, nobody brought it up, so probably it just is what it is, and that is not necessarily the case. Also want to clarify, whenever I give a talk, that when I'm thinking about sexual function and sexuality in general, to really underscore there is a very wide range of normal, and it really means different things to different people and levels of importance, and that is totally okay. The key point here is that if there's anything that you are worried about, if there's a change that's bothersome, if there's something that's different, that's distressing to you, it means that it's worth addressing. It's not about chasing some normal. It's about figuring out what might be different, or what might you be worried about, and what it is that you want to focus on. And in that same context, sexuality is a very broad term. It really refers to what I think is a sort of life-affirming experience that goes across the lifespan. And this is not just about whether you are having intercourse, whether you are doing something with your body. We're talking as much about how you feel about yourself, your identity, your experience of yourself with a partner or not with a partner, just feelings and thoughts as much as something physical. And again, you know, from the point of view of quality of life, you know, it's important. What we do know is that when people go through changes and sexual function is disrupted and unaddressed in some way, then that's related to changes in anxiety, distress, relationships can be distressed over that. So it really is from a quality of life perspective that we're talking about this today. So really to get to the sort of the heart of the matter, you know, as Terry just sort of mentioned, we know that all of the kind of modalities we bring to bear to manage and address cancer and cancer risk can potentially have an impact on not just what we do, but how we think, how we feel, and that sexuality, sexual function is really at the intersection of mind and body and interpersonal function. So really it is really sort of at that intersection point where things can be disrupted by a number of different modalities, and that just means we have to figure out what can potentially get off track in order to help that get on track. We also know that for women who are struggling because perhaps they had sexual problems or difficulties before they were thinking about cancer, they're at greater risk. Interestingly, younger women, women who are premenopausal, we often think, well, you know, it's not going to affect you as much. Well, that might not be the case. We know that often younger women have sort of more questions or changes. And the bottom line is that for somebody who's not partnered, for somebody who's older, you know, we make all kinds of assumptions around sexual function that are honestly not true. And just to say that it's important to sort of acknowledge that. So, you know, really, I think the point here is just that most women often don't feel prepared, and I really want to invite you to sort of, again, put this on the agenda knowing that common changes around menopause and medication, but very much things that we can address. So these are, I'm not going to go through each one of these, but certainly I would say this is an exhaustive list of possible changes that we often see, whether that's around desire and motivation, or whether that's a change in sexual response. So, you know, arousal, vaginal dryness, changes in orgasm. Sometimes women have pain or discomfort after menopause that we need to be aware of. So any kind of treatment where we are disrupting ovarian function, whether that is short-term or long-term, we know has an impact on women's sexual health and vaginal health. That may be from, again, chemoprevention. That may be if one goes through menopause in the context of treatment or naturally. But, you know, the vaginal tissue, genital tissue thrives on estrogen. So it's a good example of how we have sort of two sides to a coin where, you know, we often talk about estrogen as something we need to be concerned about in terms of cancer risk. We also know that we have to compensate for lack or loss of estrogen when it comes to sexual function or vaginal health, because the genital tissue actually needs, sort of thrives on estrogen. So what that means concretely is that women can lose sort of stretch and moisture and blood flow to that tissue. We know that we lose about half of our testosterone when ovarian function is disrupted, and that can have an impact. So this slide I've used forever, but I think it sort of gets right to the heart of the matter. The bottom line is that if anybody's dealing with any changes in the context of menopause, whether that's treatment-induced or natural menopause, we need to sort of think about what we can do to replace these ingredients in the recipe. This is the case whether we're talking about cancer or not, right? Just thinking about women's health. How often in, you know, regular culture do we talk about what women need to do to keep their bodies healthy after menopause in this way? We don't talk about that a lot. That's somehow not in the movies or the TV shows where, you know, women's sexuality is sort of always pegged to a male 18-year-old perspective, right? It's like, it's also about what you do to stay healthy over time. So thinking about that, I'm not going to go into any great detail, but we have to replace all of those ingredients. There are good modalities and products for all of those things. I will say that in terms of any woman who's dealing with any menopausal issues and is having discomfort or pain, just important to know that we have to learn about the pelvic floor. We have to know what we need to do to be able to improve pelvic floor function in terms of muscle, in terms of muscle toning, and in terms of relaxation. Quick comment that whenever women go through lack of estrogen or estrogen deprivation or chemoprevention and are going through these kinds of symptoms, we often assume in terms of the fix that it's just about getting moisture and using a lubricant. That's part of it. It's not the whole story. Any woman who's had any pain with any sexual activity often pretty quickly develops some muscular, sort of automatic, sort of muscle floor clenching. Nobody wants to have sex if it hurts. And honestly, we know very little about the pelvic floor, right? Most of us hear about doing a Kegel exercise if you've had a baby, and that's about getting the pelvic floor nice and tight. But we also know that over time, through menopause, through aging, actually the pelvic floor is not about just getting tight or getting it sort of toned. It's about learning how to relax the pelvic floor. It's about learning how to flexibly keep the pelvic floor relaxed when we need it to be relaxed and tight when we need it to be tight. So those are the kinds of things that are very much not particularly tied to breast cancer, but are really tied to menopausal symptoms and the sort of genitourinary symptoms that we see with lack of estrogen. I will say in the context of thinking about anything regarding changes in breasts, whether that's surgery, whether that's preventive surgery, whether that's surgery in the context of cancer, it's common that we think about how women look. And I really just want to underscore the point that sometimes changes that affect us are obvious. Sometimes they are less obvious. So lots of times women will have questions about reconstruction, and we go into great detail about some of the visual impact of that. We don't always talk as much about what that means to potentially lose sensation, what that means to recover sexual function, if you've lost some of, if you have no breast sensation or nipple sensation. The point here is that we have a roadmap to be able to help women think about what that means to reclaim a sense of wholeness, of sexuality, of body integrity, but it's not always obvious if we don't ask about it. It's not always obvious if we don't have some coaching or some support for that. So I think the point here is that in the context of any kind of breast surgery that you might be contemplating or potentially facing, it's just important to be able to ask your doctors about that, to be able to ask what to expect in terms of both visual and physical, in terms of perception and sensation, and to know that we can get some help with that if we're needing to sort of think about what it means to move on to the other side of that and maintain a sense of integrity and a sense of pleasure in our body. So the point here is that I guess I would say when I step back and think about what this means in terms of mind-body connection, when women face changes in a sense of body integrity, or when women change in sensation or change in function, it's really common that we get anxious about that women may want to avoid or distract from anything that's going to feel distressing or that's going to sort of raise a red flag about, oh gee, I don't want to go there, or I don't want to sort of get to a place where I'm going to have to talk to my partner about this. And I would invite you to sort of come with me to that perspective that it's really about learning to cope with changes, right, is the goal here. It's not about figuring out how to avoid them, right? And I think that, again, because we often don't talk about some of these real changes in a very frank or direct way, the default for many of us is just to kind of try to tune out and turn off to that part of our experience, which is really not necessary. So there is, I guess, the point here is a kind of framework for what to do. It's not anything that I think any one woman or a couple have to sort of figure out and make up for themselves, but sort of remembering that sexual function and sexuality is really at the intersection of, physical health and so when we sort of think about that idea, sort of mental and physical and cultural, right? Cultural, I will also point out that lots of times, whether it's our own experience, our own families, our own cultural heritage, that we don't talk about certain things. That can be okay for a while, but sometimes we have to find a way around that, right? For example, a couple that's never really talked much about sex, it's not a problem if everything's fine. But then what happens when things are a little bit different or changed, and then it becomes awkward, and we don't have a kind of history of how to talk about that stuff in a direct sort of way. So sometimes we have to figure out kind of where things get off track in order to figure out what we can do about it. So really underscoring the point that Dr. Porvu just made around sort of physical health and overall health and well-being, that's absolutely the case when it comes to sexual health, right? That we really have to sort of think about the body and sexual health as if it's sort of any other aspect of overall health and well-being. And that if anyone's dealing with any of the kind of mechanical changes like pain or vaginal dryness or discomfort, that's obviously something we need to deal with first. We also know that when it comes to lifestyle, right, if you are sleep deprived, if you're not exercising, if you don't feel well and you don't have a good sense of vitality in general, you're probably not going to have a whole lot of energy for sort of romance or sexuality, right? And we need to sort of think about that holistically. And also just to say that, you know, sometimes there are other issues, right? Sometimes women are struggling and on an antidepressant, and that's very useful in certain ways, but on the other hand, has a really significant side effect profile. I can't tell you how often I've met with folks who don't realize that the reason, for example, they can't have an orgasm has to do with the kind of antidepressant they're taking. Just haven't made that connection, right? So recognizing that, you know, that might be an option to talk with your doctor, think about a different medication that has a different kind of side effect profile. Just sort of putting all of those pieces together is very important. And from the point of view where I sit in terms of cancer and breast cancer and cancer risk, I also spend a lot of time talking with women about what it means to be in the body without anxiety. What does that mean to acknowledge potential changes, accepting some of the potential changes that you might be facing, but know that you can still be in the body without feeling anxious, right? So that might be starting with just getting active. That might be around just whether that's dancing or weight training or yoga or something that allows you to be in your body really present, right, without feeling freaked out or without feeling like you have to kind of disconnect from your body. And I will say that, you know, for anyone who's actually gone through cancer or cancer treatment, you know, it's actually helpful sometimes to kind of disconnect from your body, right? Anybody who's getting a mammogram or MRI knows that, you know, the best thing you can do is go on vacation in the moment, right, and not want to sort of be fully present. And that's helpful in that context. But then if we kind of get into that rhythm where we're sort of regularly disconnecting, it's not always obvious how we sort of reconnect, right? It's not always obvious how we can sort of be fully present in our body without feeling panicky. So I think that I would just say that that is not obvious, and that's something that often women and men actually can benefit from having a little bit of coaching, a little bit of help, a little bit of practice. That is something that is a skill that we have to kind of reconnect to, especially if we're used to being in a place where we're doing some of that disconnection. So again, you know, on that note, we're talking about, you know, what that means to tune back in. That also means tuning into that kind of tape loop in our head sometimes, right? That often the case where sort of out of awareness, we have a kind of a loop that plays over and over around all kinds of automatic thoughts. And I say this, you know, this is not just about cancer, right? This is about women and women's bodies and our crazy culture. This is about what you say to yourself when you're going to try on a bathing suit in any fitting room in America, right? There's that tape loop going through your head. And that the reality is that lots of those thoughts are intense, they feel big, but they are likely not true, right? Or they may not be true, or they may be sort of far from the truth. But we often aren't even aware of how much these kind of intense thoughts and intense kind of automatic thoughts drive how we feel. So that's sort of a part, I think, of sexual renewal, of sexual rehabilitation, whether that's in the context of cancer, or whether that's just in the context of aging and menopause and just being a woman in our culture today. I will take a second just to talk about the relationship piece. You know, obviously, I see a lot of couples, and obviously communication is a big part of what I do, is sort of helping couples talk about these things that often feel awkward or uncomfortable. It's amazing how many times people say, you know, it's a weird thing. My partner's been a saint. We're very connected. We've been married for 25 years, but this feels weird. Right? It's hard to talk about this, right? It's hard to talk about, you know, somebody who's just had breast surgery, and I've literally had partners say, well, I don't know where to put my hands. Literally, right? And a woman says, well, I don't know what to say, because like on one hand it feels good, on one that they want to put their hands on my body, on the other hand, don't go there. It's just an awkwardness. And so what happens is that couples avoid that whole context, and that's too bad. Because what ends up happening is that you lose a sense of intimacy, you lose a sense of connection. It's not just about where you put your hands. There also ends up being a kind of a funny dance that gets done because everyone's trying to protect each other, protect themselves, and that is something which we have other options. You know, there may be other ways to extend that conversation, to have a conversation where people don't feel like they're going to be hurt or hurt each other, but can actually make you closer. I will just say that partners don't get a lot of education about any of this, so if anybody is contemplating or facing any kind of changes or surgeries or chemoprevention, partners know very little, right, often about who talks to partners, about how to talk to each other, about what to do or what to say. So we need to take that seriously. And also around dating and disclosure, I will just say that it's really common that lots of women have lots of questions. You know, we just did a pretty cool sex and dating workshop for sort of literally standing room only. And so many of the questions were really about, like, in the end, the conversation, both for men and women that were there, was like, how do you start? What does this mean if I'm not married? What does it mean when I date? Is this like, do I talk about, like, you know, if I have cancer risk, you know, do you share that when you're dating? Do you not? How do you not? What does it mean? Those are the kinds of questions that you need to have an answer for, right? It can't just be something that is swirling in your head, because often when it does and you don't feel confident about how to address it, you might just avoid intimacy altogether. So last comment I will make will be on this sort of issue around low desire. I say this because lots of women have questions about it. It's probably the most common problem that we know women endorse, period, with or without cancer, with or without cancer risk. But lots of times the assumptions around women's desire are really untrue. Let me just say that our model about what desire is, sexual desire, is very much built on a male model, right? Where we start with this notion of desire is just something you have, like a light switch on and off, which then leads to behavior, which then leads to arousal, excitement. But the notion that women just have desire like a light switch over the course of a lifetime is kind of a weird notion. We know that women's desire, first of all, is more circular, that lots of times we have to have an experience that arouses desire, that cultivates desire, that gets us in the mood, rather than it be something that's just like out of the blue. And lots of times we worry about, you know, for example, going on chemoprevention or a treatment that may impact desire with the assumption that once you have low desire, there's nothing you can do about it. And again, very much not the case. But we do need to be able to think about what that means to cultivate that experience, what that means to think about desire as being an experience that is, I guess you could call it responsive or reactive, right? Something that you cultivate rather than you just assume to be the case, like I said, like a light switch that's just spontaneous. I think spontaneous desire fits very well with people that are like 20 years old. I think that works very well with couples that have been dating for about 6 or 8 weeks, right? I think that, you know, most of us know over time this notion of spontaneous desire shifts. And again, when you think about the real experience that we have versus what we see in movies and on TV, which is awesome and fun and interesting, don't really map on, right? So most of us have to think about what that means to create and cultivate an experience around curiosity and attention and novelty and intention, right? Where we sort of have to make time for something, where we have to prioritize it, rather than pathologize it and assume that, okay, well, I just don't have any desire, I'd rather read a book, game over, right? That's probably not a great model. So, you know, just giving you a snapshot of the kind of work that we do in the sexual health program around low desire, it's really to sort of think about how do we shift the model? How do we sort of focus on what is pleasurable rather than feeling pressure? How many times do women feel badly that they aren't in the mood and then they feel guilty and it's like my partner's been a saint and then you have to avoid that altogether because that just feels bad. But that it's really about sort of taking a very different approach. It's about not sort of focusing on do I have desire, but it's about saying, what's pleasurable? What would make me feel closer? What would allow me to to sort of just figure out what feels good for me, for my partner, what just would make me feel relaxed, maybe interested or curious. And that it really is not about being like a military campaign, right? It's not about saying, I have to have this or I don't. But it's really about taking kind of a much different approach around curiosity and motivation that allows us to sort of have a way in, right? So that's the case in terms of low desire. Again, I don't think that's the case only around cancer or cancer risk. I think that's a broad issue in our culture about sort of focusing on what is important for women. So last slide or two, just to say that around sexual rehabilitation, sexual renewal, sexual function in general, I think it's important that we move from a model of spontaneity to intention, sort of saying that this is a priority, if it's a priority, what it is that I'm interested in focusing on, and sort of figuring out how to make a plan, you know, how to sort of I guess this takes us out of a place of saying, I'm just going to wait and see. I don't think in general sexual function or sexual problems self-resolve or just get better over time. Typically they kind of just percolate, you know, or we sort of avoid it and they don't go away. But the good news is that with intention, right, with a kind of a conscious decision that we're going to work on it, we also know that we can make things better. So last slide is just the point here is that sometimes there are changes, not that we choose, but that are coming, and we have to acknowledge that there is often an opportunity there. I'm not saying make lemonade out of lemons, like in the context of cancer. I personally hate that phrase. But I will say that if there are changes, it's really important to know that we can get creative, that we can chart a new course, that we really can expand the repertoire, and we really can help women and couples focus on things that are valuable, like pleasure, like sensuality, like intention. And then with that perspective, we're really able to, I think, to get active and to really make things better. Thanks for having me here today. I'm happy to take any questions.